Hi everybody, my name's Molly and I'm a student at the University of Western Ontario. I'm in my honors specialization in dietetics and I'm hoping to also receive a major in psychology. So hi, I'm here to talk to you a little bit about eating disorders. First things first, people with eating disorders are often afraid to ask for help. They may have low self-esteem, which is making them feel as though they do not deserve help, or they might not feel sick enough to need an intervention. They might think that they're in control and that this is just a routine that they've worked themselves into. But regardless of how difficult it may be to approach the topic, it's crucial, because eating disorders will only get worse without treatment, and the physical and emotional damage, as we know, can be quite severe. We can't wait for the individual to necessarily approach us. It's fine to approach them. Because the sooner the recovery process begins, we know the better chances of a full recovery. My biggest piece of advice is for you to communicate your concerns in a loving and non-confrontational way. It's important to remain positive and respectful and not to sound too accusatory. We don't really want to put blame on the individual, and we don't want to make them feel like they're doing something wrong necessarily. It's likely that the individual suffering is in denial that they have an eating disorder, or they may not want to give up their eating disorder quite yet. For this reason, it might take a couple times before the individual is willing to open up. I know I definitely denied my eating disorder the first time I was approached, especially because when my dance teacher pulled me aside that first time, I had never even really heard of what an eating disorder was. So remarking on my weight loss was a shock to me. I just kind of thought I was losing a bit of weight. In hindsight, my dance teacher probably shouldn't have brought up the topic by saying that I had lost weight, and instead maybe she could have approached it by saying that she was concerned about my health. Because personally, I feel it's better not to comment on how an individual looks, because appearance is definitely not the underlying issue of an eating disorder. Comments about my weight, I find, reinforce my obsession with my body image. So when she pulled me aside back in 2011, it made me realize that, hey, maybe I am good at something, and better yet, maybe I'm good at something that gets me noticed. I really felt like I had accomplished something when she noticed my weight loss. I wouldn't say that her comment triggered my eating disorder. However, it did turn her worries into a positive situation. And it made me worry that if I gained weight, people wouldn't notice me any longer. When confronting somebody with an eating disorder, try and avoid placing shame, blame, or guilt on the individual. Don't label them as their illness. Somebody is not anorexic. They are experiencing anorexia nervosa. I really hated feeling like a bad person. I already had so much guilt inside of myself for troubling my family, and I already felt like a burden. So try not to say that somebody's exhibiting bad behavior. They're just under the control of their eating disorder. Also, when you're creating a solution, don't try to make it sound simple. Just eating doesn't make everything fine, and just eating is not something somebody with an eating disorder can really do. This being said, don't back away from your battle. Stand your ground. You can't let a person think it's okay to throw out their lunch, and you can't let them get away with throwing a fit and not having to eat a meal. That'll really just enable the eating disorder more. So when mentioning recovery, it's also best not to demand the individual changes their habits, because ultimately you can't force someone to change. The decision to seek recovery really has to come from them, or else it won't last. I've learned that if I recover from my parents, or if I recover because I want to go back to school, the one that's for me, which is going back to school, is a lot more powerful in sticking with recovery than the goal from my parents, because it's not something I value as much. Definitely, I do value my parents' opinions, so they are a good motivation, but something that comes from inside is definitely more motivating than a doctor saying you have to recover. When suggesting recovery, maybe start at suggesting that they go to therapy, a nutritional counselor, or a support group. I personally found that individual therapy was the most beneficial. I preferred to go without my parents because I felt that I could more openly discuss my anxiety and fears that I was facing. I was kind of embarrassed to let my parents know everything, or I worried that if they knew everything, I wouldn't be able to engage in any of the behaviors. And it's definitely a winding down process. You can't cut out all your symptoms at once. But I do know that family therapy is effective for dealing with the impact of eating disorders on the entire family unit. So if the family does want to be part of the therapy, maybe that is a good idea, or maybe the parents can meet with the therapist ahead of time just to know what goals the individual is working on. In university, I see a psychiatrist, which is covered. Unfortunately, I'm not really able to see her as often as I probably could have used at the beginning of the year. I only really see her about once a month. Some people aren't as fortunate and they see her every 6 weeks or so. I didn't experience a wait list getting getting into school, but I know that a lot of individuals who don't have a pre-existing diagnosis are turned down from health service teams, and they have to seek out private therapy in their communities. There really just aren't enough resources to be distributed to everyone, so that's really hard. I'm also registered with academic accommodations, so I get to write my exams in individual rooms, and to me that's really helpful. My university doesn't have support groups, but that is another thing that I would suggest individuals recovering from an eating disorder partake in. I think that that would be a really valuable addition to our school's health services, because they definitely do maximize a therapist's time, and it also allows individuals to connect so they don't feel quite so alone. Support groups worked really well for me because they made me feel less isolated in my struggles. Lastly, always remember that recovery can take months, years, or decades. Don't expect perfection in anybody's recovery journal. It's not linear. And make sure you don't tell the individual that they'll be recovered by blank day. That's just setting them up for failure. But yeah, thanks for listening, and I hope you found something helpful. Take care, and thank you for supporting people with individuals with eating disorders.